Hi, my name is Maria Escobar. I'm here with MedEdge, and we are present at the 11th Abu Dhabi International Conference for Dermatology and Aesthetics. And today I have the pleasure to speak with Dr. Yousef. How are you, doctor?
I'm good, thank you.
Thank you so much for being here. I know you're a busy man.
Thanks. Okay, having me.
Doctor, tell me about yourself. Tell me first what you do, your profession, your specialty.
So I'm Yousef Bin Amer. I'm the chairman of the Department of Dermatology at King Faisal Specialist Hospital in Riyadh, Saudi Arabia, which is like a very big anti-cancer hospital. I have been trained in Canada. I'm certified by the American board as well as by the Canadian board with an certified EMBA certificate as well and advanced medical dermatology fellowship as well.
Yeah, perfect, doctor. You have it all. Make sure you're fully certified everywhere. But tell me about your profession. Tell me what is that you're excited about all the time.
So my practice mainly in advanced complex medical dermatology. So I do focus on more of medical advanced and complex dermatology like an autoimmune blistering disorders, skin cancer, skin lymphomas, and psoriasis, atopic dermatitis, where we need a systemic treatment for the complex cases.
Okay, amazing. Are you going to be speaking about this here in the conferences here?
I did a talk about the skin lymphomas this morning.
Okay, perfect. How did the talk go?
So that it was a good talk, and people are interesting to know about more skin lymphoma because skin lymphoma, it does look like other skin problems. So the distinction between these diseases is very important, as well as the treatment management of the skin lymphoma should be tailored according to the patient's situation. To skin lymphoma, we are seeing it more common in our population because of skin of color. So our skin is a bit darker, so where the hyperpigmentation, the lining of the skin is a bit light, so maybe people they will become more worried about the whitening of the skin, and when we do the biopsy it will show up as like skin lymphoma where they do have a special treatment for that.
Okay, let's talk about this so we can educate the people at MedEdge. What will be an early sign of skin lymphoma that you say, okay, if you see this on your skin, you definitely need to go and see a dermatologist?
So if you have a skin rash that is persistent for like couple of months, especially over the sun protected area, for example, on the axilla, on the buttock for a long period of time, that is do not respond to usual like moisturizer, please go and see your dermatologist. It might be a sign of something else.
Okay, perfect. That's a really good title. Okay, doctor, and regarding this conference, let's go here to AIDA. How many AIDA conference have you participated?
This actually my first time.
Perfect. Okay.
So I'm very excited to be part of the conference. It was like very interesting. It has a good value, scientific. It's good social gathering, social networking. So it's one of the meeting that I have seen it so far. It is like it has a lot of scientific value.
Yes, and thank you for bringing that up. So it is my first time on this one as well, so we're learning together. But something that I've seen is they really brought the best of the best from around the world. And then the topics are very interesting. They're very updated into technology. Is there any other topic that you have heard in the conference or is going to happen tomorrow that you're interested in seeing or hearing?
So we have this early morning, we have talked about vitiligo and the new advancement in the management of vitiligo. There was some talk about alopecia areata and the advancement of treatment of these conditions. Why I'm focusing about vitiligo and alopecia areata? Because these diseases were forgotten for many years. Just over the last 3 years, people they start to think about them and there was a new innovation. So especially vitiligo in our population, because it has some stigmata, and people that are usually have concern about vitiligo, what I see now, there is many treatment that is coming soon, which will help these unfortunate patients.
Yes, yes. I actually had the interview with the doctor who's using the new medicine and is quite a breakthrough into the dermatology. So this is very interesting. Yes. Perfect. Doctor, I know you specialize more into the conditions that are a little bit more severe, but what would be an advice that you give to the general public, men and women, regarding skincare?
There is a three things. First, avoid tanning. No good tanning at all. Okay, wear some sunscreen. If you see any spot that is changing, that's causing any problem, any bleeding, please see dermatologist. And avoid following whatever on the social media. Please, please be careful. Not everything in the social media is correct. Maybe 95% what is in the social media is a pure business and marketing. Only 5% is the true, and there is a science and fact behind it.
Yeah, very good advices because people definitely need to be more educated into the reality of things instead of what the social media brings.
This is why we are just maybe like 10-20% of our patient, we are treating the side effect of their problems which they arise from the whatever social media. I will not name it. So we have to be very careful.
Yeah.
Not everything in the social media is correct. What does work for your friend, it doesn't mean that's going to work for yourself.
Very good advice. That's very, very true. Okay, perfect. And doctor, just last but not least, why did you decide to work in dermatology? Why did you choose this field that is so complex, but at the same time so innovative all the time? Why did you choose to be in this field?
Skin is the window to look inside your body. So from the skin, you know a lot about the person which is in front of you. You know how is he good taking care of himself. Do you know you can predict some medical conditions? So skin is the window to know a lot about yourself. You don't need a lot of investigations. You don't need a lot of blood tests. You know, you see, you ask a few questions, you got diagnosis, and then you treat. So the skin is the window to your body.
Okay, that's perfect. And I'm kind of scared now. I'll make sure I guess I do the basics, definitely for the nutrition part. I'm a nutritionist, so I do that part. And I do wear my sunblock every day and I do all those things. So perfect. Okay. Amazing. Doctor, thank you so much. What a pleasure having you here.
You're most welcome, and thank you for inviting me here.
Yeah, hopefully to see you in AIDA conference every year. We will see you every year from now on.
Hopefully next year.